Why is inner ear anatomy critical for hearing loss surgery? Imagine trying to fix a delicate machine without knowing how its tiny parts fit together. That's exactly why understanding the inner ear's anatomy is so important for hearing loss surgery. The inner ear contains the cochlea, a spiral-shaped structure that transforms sound vibrations into electrical signals our brains interpret as sound. Inside the cochlea are thousands of tiny sensory hair cells, each tuned to specific sound frequencies. When these hair cells are damaged or lost, it causes sensorineural hearing loss, which cannot be fixed just by making sounds louder. That's where surgery comes in. Procedures like cochlear implants work by bypassing damaged hair cells and directly stimulating the auditory nerve with electrical signals. To do this successfully, surgeons need a detailed map of the cochlea's shape and size to place the implant correctly without harming remaining structures. In cases of conductive hearing loss, such as otosclerosis, surgeons often perform procedures like stapedectomy. This involves removing or replacing the stapes bone, which transmits sound vibrations from the middle ear to the cochlea. Knowing exactly where the stapes is and how it connects to the inner ear helps surgeons avoid damaging the cochlea or nearby nerves. Because the inner ear is so close to important nerves and blood vessels, precision is vital to prevent complications like nerve injury or further hearing loss. Reconstructive surgeries that reopen or create ear canals also depend on understanding inner ear anatomy. These procedures need careful manipulation of bones and soft tissues near the cochlea to avoid causing permanent damage. Emerging treatments like gene therapy, which deliver genetic material into the inner ear to restore hearing, also requiring detailed knowledge of the cochlear fluid pathways and access points. This ensures the therapy reaches the right place without harming sensitive structures. In summary, knowing the inner ear's anatomy is essential for safe and effective hearing loss surgery. It guides surgeons in accessing and manipulating the cochlea and auditory nerve, placing implants accurately, avoiding damage to delicate sensory cells and nerves, and successfully performing reconstructive procedures. Without this detailed understanding, the risk of causing more harm increases significantly. That's why thorough anatomical knowledge is the foundation of successful hearing loss interventions, and why consulting experienced specialists is always the best choice for anyone considering surgery.